Rotation tricks. Anyone who's done orthodontics for any length of time will tell you rotations can be the trickiest things to correct. And we've talked quite a bit about correcting rotations already. Some ways you can do it. You can fully seat that nickel titanium arch wire into the bracket slot so it can express that shape memory and bring the tooth along for the ride and correct rotations. Now we talked about how to do this with ligature ties, okay? But you can also use figure-8 ties and what are called double over ties. I'm going to show you a few different ways to do it. Try them all and see which you like the best. Okay? They all do exactly the same thing. They are completely analogous to each other. One isn't stronger than the other. Ligature ties, figure-8 ties, double over ties, all lock the wire into the slot. So here we have this ligature tie. We have this very rotated lateral incisor. And if we were just to put an O-ring elastic on this tooth, what can happen? That elastic loses power and the wire pops out of the slot, making it less effective in returning that tooth to proper alignment, correcting the rotation. So instead of using an O-ring elastic, we can use a steel ligature tie that will lock the wire into the slot, and the wire will not come out of the slot because it's not elastic, it's steel. Okay? Now, when you are placing that ligature, make sure the part you're twisting, the knot, is on the side that's furthest away from the bracket, okay, where the wire is pulling out of the slot the most. The knot is the tightest part, and also it's going to be a million times easier to tie it if you do it this way. Again, you want the knot on the side where the wire would be pulling out the most, where it would be furthest away from the bracket, before you tie it in. And you want to really make sure you pull these ligature ties from the mesial or distal, not incisal gingival direction. From the mesial or distal, you'll actually feel it lock on. Then maintain tension, twist it tight. Then once you've twisted it tight, take your pin and ligature cutter and cut off that extra length, leaving about 2 or 3 millimeters of extra tail. Then pop in there with your ligature director and tuck it away. So again, come from the mesial or distal, maintain tension, start twisting. Then come in with your pin and ligature cutter to cut, but leave 2 or 3 millimeters extra length of tail. Then come in with a ligature director and just push that behind the arch wire, ideally alongside the bracket. Take your finger, rub it on there, make sure it doesn't poke your finger, pokes your patient's lip. Okay? And there is the ligature tie completed on that central incisor. And here's a video to show how we do it. So remember, pull from the mesial or distal, not incisal gingival direction. You actually feel it lock on. Start twisting. Now what I like to do is I like to re-grab it and pull again, so I know it's going to be very firmly secured on there, and then twist it again. Then you would follow up with your pin and ligature cutter to cut. Again, leave about 2 or 3 millimeters extra tail. Take your ligature director, tuck that behind the arch wire, alongside the bracket, rub it with your finger to make sure it's not going to rub your finger. Rub with your finger, it's going to rub your patient's lip to be uncomfortable with them. Figure-8 tie, another way to lock the wire into the bracket slot, analogous to ligature ties. It's just another way to do it. What you do is you place your arch wire, then you place an O-ring on 2 proximal wings, cross over to the gingival aspect of the 3rd wing, and the last thing you do is twist to complete the figure-8. Here it is on the typodont. Place the O-ring on the 2 proximal wings. Now cross it over the face of the bracket and hook that O-ring on the gingival aspect of that 3rd wing. And now the last thing you do is twist it over to complete the figure-8 tie. Again, it'll help lock the wire into the slot. And here's a video showing you that. Get it on 2 proximal wings, cross over, hook on the gingival, and twist. Okay? That's how you place a figure-8 tie. Double over tie is another great way to lock the wire into the bracket slot. You place a 2-unit power chain on the bracket of the tooth before you place the arch wire. So it's underneath the arch wire. Then place the arch wire, and you're going to grab that second unit of power chain. It's just a handle. You're going to grab it, and you're going to pull so that power chain that's underneath the arch wire along the bracket comes over and around, and you hook it on the bottom brackets. Then you're going to cut off that extra unit. Remember, it was just a handle. So when you're done, you'll have one unit of chain that goes from behind the bracket, it comes over the arch wire, and then onto the tie wings. You basically double bungee corded that arch wire very securely into the slot. So again, here it is on a typodont. Place your 2-unit chain on the bracket before you place your arch wire. Then go ahead and place your arch wire in and ligate it everywhere else. If you try and activate the double over tie before you ligate it, the wire's just going to fly out. Okay? Grab the handle and pull that single unit that's behind the arch wire over the arch wire and around, and then tie it onto the gingival tie wings. Then you would cut off that extra unit, which again was just the handle. Now when you're done, the top wing will actually be empty. It's one unit over and around, again, double bungee cording that arch wire into place. If any of you have been doing cases with composite brackets, and you know how the top tie wings can get worn on a lot of patients, and then the O-ring doesn't stay, rather than replacing that bracket, you can use a double over tie instead, because the top wing is empty anyway. Okay, so that will save you the time and expense of finding a new bracket. And here's a video showing how we do the double over tie. Again, place your 2-unit chain before you place the arch wire. Then place the arch wire and grab that handle and bring that same single unit over and around. If you couldn't get on all 4 tie wings, remember you can always use an Explorer or sickle scaler to get it the rest of the way. Then cut off the extra unit and you're done. Okay? Very, very, very straightforward and easy way to lock the wire into the slot. Now, they all do the same thing. Ligature tie, figure 8 tie, double over tie, all lock the wire into the slot. The reason I show you all 3 ways is you may like one more than another. Or you may like one more in one area of the mouth than another area. Maybe you like ligatures in the anterior and double over ties in the posterior. Or maybe one of your assistant likes one more than the other. So you say, hey Joe, go ahead and lock number 8 into the slot. And you don't care if he places a figure 8 tie or a ligature tie or double over tie as long as it's locked in. Okay? Try them all. See what you like the best.
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/Powerprox Lab.